Our clinical efficacy grading data showed that lip balm treatment improved significantly the lip condition during the treatment period.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar. You know, what's the topic today? I've just been kind of thinking about lips a lot more.
Oh, yeah. Don't get lippy with me, my friend. We are talking about lips, and we are talking about lips because we often forget, it's a small surface area. It's part of what we do, right? Dermatologists look at the skin and the oral mucosa, and the lips are kind of that communication between the skin and the inside of the body. But also it's how we feel food. It's a very, very important part of our expression. So just having healthy lips is so critical. And I think a lot of times we focus on disease state like colitis and such, but really talking about healthy lips, what does it take to have healthy lips, is something that we don't talk so much about. And I know my patients, a lot of them want to know, what can I do to keep my lips looking healthy?
Yeah, on that note, before we jump into it, let me just say we have a very good friend of ours that's been on our podcast many times. We love talking to Dr. Hemali Gunt. She is head of clinical and scientific affairs at Burt, and she has been focused so much on the science there, done a lot of scientific studies, so she knows this area inside and out. Hemali, welcome to the podcast, and I'm excited to talk lips with you.
Thrilled to be back, Raja and Hadar. Thank you for the intro and for giving us a platform to share our progress on lip science. Really excited to be back.
Well, now that we're talking lips, let me just start off by saying, for a lot of people, when we think of lips, you immediately jump to cosmetics like fillers and just how plump the lips can be. But I think we realize that lip health is much beyond that, isn't it? And so maybe you can get us started off here by just talking to us about what prompted you to think about lips and how is it different from the skin on the rest of our body?
So what prompted me to think about lips is obviously Burt's Bees lip balm. It is our flagship.
You guys are the leaders when it comes to, unique approaches, whether it's skin or lips, but lips is definitely an area of expertise for you.
Right. So it has been a flagship product, for 40 years. And it is one of the consumer favorites. But again, if we just look at the marketing side or what consumers like versus what we know about the product and what we know about how it interacts with the membrane where you're supposed to apply it, there is not a lot of research. And so the last couple years, that has been our focus. Let us really understand lips. What are the different ways to measure lips? Why are lips really even important, in the grand scheme of things when they occupy such a tiny part of your face? So we have been, slowly but surely diving into all these questions and understanding, at the end of the day, the product has to interact with lip skin. And how do we best get the right product for the right kind of condition that we have? And I know Hadar mentioned diseased condition, but diseased is, a few % of the population. Pretty much everybody has normal, healthy lips. And even when you're applying products to normal, healthy lips, what is it doing? So that's where really the conversation started. And to answer your question, how is it different from the rest of the body? And again, Hadar said, it's an internal continuum of your oral cavity. And it's part of the oral cavity transitioning of the facial skin with the oral mucosa. But the properties are so different, right? I mean, it's so much more thinner. It has incomplete corneocyte formation, and therefore it has really poor barrier function and water holding capacity in comparison to fully formed stratum corneum. It does not have melanin cells, and so the blood cells or the blood vessels are more visible. And again, more importantly, the biggest difference is it does not have sebaceous or sweat glands, in comparison to the contrasting facial skin, also which makes it more susceptible to pathogens or drying conditions, extreme temperature fluctuations. All these things cause it to become chapped and dry faster. And also, often because of that, there are manifestation of viral infections, which we see a lot around cold sores. So those are the primary differences between the facial skin and lip skin.
That's very interesting. I think you mentioned your kind of approach to applying rigor to how you conduct yourself and looking for products that may work and how they interact with the normal skin. And I think for that, don't you need to have some kind of a definition of what it means to be healthy first before you can even start to think about disease, or not even disease, just the interaction of the product with healthy lips? So what really defines healthy lips?
It is not defined.
Okay.
Actually,
Yeah.
this was the challenge, is that while we all think, and this was a great conversation that Hemali and I even had, which was, what is the actual definition of healthy lips? And then we started looking, we're like, gosh, we kind of just say people have healthy lips when they have a disease state. We just say, okay, this clearly is a diseased kind of lip, but what is it, the characteristics that make a lip healthy? And so actually there was a collaborative survey between Learn Health and Burt's Bees, where we deployed anonymous surveys to a bunch of practitioners, including a majority of them being dermatologists and dermatology residents. And we identified, thanks to Hemali and I kind of working through what are all the characteristics that people might actually consider. And Hemali, maybe you can speak a little bit more to this, but we were able to then identify, what do most professionals looking at lips think that the definition should be based on? Molly, maybe you have more insight into, the impetus for this sort of survey.
Yeah, no, you're right, Raja. You actually, hit it right on its head. We don't know much about lip health at all. Skin health, yes, it has been studied extensively. You have mechanical properties and biophysical properties and cosmetic parameters that have been studied for such a long time, but a corresponding definition for lip health is missing. And so we, thanks to the partnership with Learn Health, we created this survey. And what we looked at was a variety of different characteristics were provided in that survey, and it was done on a 5-point Likert scale. So there was lip dryness, smoothness, even tone, definition of the vermilion border or lip contouring, lip color, shine radiance, lack of lip lines, lip fullness, and lip firmness. There is a very defined scale when it comes to lip plumping and pullers, when it comes to fillers. But in general, over the years, what happens to lips is the common characteristics that we were looking at. So those were anonymously, like Raja mentioned, provided to the participants. And then there were, I believe, 334 participants. I'm sorry, Raja, correct me if I'm wrong. 169 were derms, I remember very correctly. And then we had a combination of physician, aestheticians, nurse practitioners, and other allied health professionals.
Yeah, that's right, Hemali. It was 334, 169 dermatologists, dermatology residents, 46 physician assistants, 28 nurse practitioners, and a partridge in a pear tree. No, I'm kidding. And then 91 allied health professionals. So
Right.
we did not survey any birds.
Yeah, exactly. But it sounds like a really good sample size, but it also provides good perspective, which is what you want when you are trying to really provide early definitions, right? So you get different perspectives with a good sample size. So congratulations. That sounds like a promising start.
And I wanted to lay out what were some of the characteristics, if you don't mind, Hemali. Maybe we can just mention all of them. So we looked at lip firmness, lip fullness and plumpness, lack of lip lines, lip shine or radiance or luster, lip color. We also looked at the definition of the vermilion border, even tone or lack of hyperpigmentation, lip smoothness, and lack of lip dryness as characteristics that people would rate as being either very important or not important at all, like you said, on a Likert scale. And it was actually quite fascinating, wasn't it, Hemali, what
Correct.
came out of this at the end of it all, when you look at the top features.
So the top 3 most important visual features were lack of lip dryness, lip smoothness, and even tone or lack of hyperpigmentation. And I'm going to pause here and ask a question to you guys. Is it something that is unexpected, or is this expected?
Well, in retrospect, when you think about this, gosh, the dryness is kind of like what goes out of control when you get chapped lips
Right.
and you lose that normal texture, the smoothness goes away. And so that actually makes sense. And then the even tone or lack of hyperpigmentation, we know that probably youthful looking lips haven't had too much photo damage. And as the photo damage occurs,
Mm-hmm.
you would think that even tone would be lost. So when I'm looking at this, I guess I initially thought that maybe like lip firmness or plumpness would have been there, but it just wasn't there according to the
Right.
dermatologist. It was
Right.
actually on the other side of the spectrum. They didn't even rate it in the
Exactly.
top five, you know? So it's actually fascinating from the results.
Yeah, that was surprising to me too. And like we do a lot of consumer, surveys perception. And it's usually the plumpness and fullness. That is what they are looking for. And they are really, consumers are not looking for this even tone or lack of hyperpigmentation. So it's very interesting how two different audiences view the same parameters. So that was very, very intriguing and interesting to me. And it's like, how do you actually get them to understand perhaps that, yes, I mean, that's an important component too, but if there is hyperpigmentation occurring on your lips, they're not going to look healthy as well.
And I think actually I agree that it is very interesting, and perhaps the healthcare providers, which you seem to have captured here, really think about absence of disease as health, as opposed to the
Right.
consumer who may look at, the plumpness and the notion in society of what beauty is, youth is, so that those kind of associations are more strong there. But, on that part, I'm maybe hypothesizing, but I'm not surprised that healthcare provider really look at lack of disease. That's their guide.
You know what was also really interesting, which I think we are taught this in residency, look for this when you have photo damage, is the definition of the vermilion border.
Mm-hmm.
And you like to have a really good definition, meaning that you have a defined lip contour along the edges. When that is present, people considered that to also be another marker of lip health. That was the fourth one of the top four. And what I found also interesting, Hemali, maybe you can speak to this. I don't know if you thought this was something you would have expected, but when we compared how dermatologists and derm residents rated the lips compared to other healthcare professionals, it was actually pretty similar. It wasn't that
Correct.
different,
Right. So the
which is pretty interesting.
the top three were essentially the same. It was the
Yeah,
difference started to come out around the fourth feature. And like you
right,
said, it was the
right,
vermilion border for dermatologists and derm residents, whereas for other healthcare professionals, it was lip color.
right. And lip shine, right? Those were pretty close. Lip color
Correct.
and lip shine. Anyway, very fascinating. Okay, so we got all of this from the survey. And so what would be the next steps from this learning that we've gotten? And I know that Burt's Bees is, it's really known for its different products. And I know that you've studied lip health with your lip balm too. So do you have some other data that you wanted to discuss as well?
Yeah, definitely. So, this is obviously, I mean, there is a reason we are studying lip health, right? I mean, at some point, we do want to be able to objectively track lip health for clinical evaluations, for clinical research, and we need to have something much more standardized. So, this is the first step towards getting there. But in addition to that, I mean, this part aside of defining lip health, we are obviously studying our products for safety and efficacy. And our flagship product, the beeswax lip balm, has been studied extensively by us over the last, 10, 15 years. And very similar to, moisturizers for dry skin management, lip care products are important when it comes to lip health. And so we conducted a pretty rigorous study. And there is this regression protocol, which you guys are well aware of. We studied our lip balm in a lip regression protocol where we actually look at the product in three different phases. So there is a washout period when folks are not using anything on their lips. Then they use the product for a period of 4 weeks, which is the treatment phase. And then there is a regression phase where you actually take away treatment and see what is happening to the lips. Are they being maintained, or, do they go below baseline where they started? And so when we studied our product in this particular model, we evaluated lip condition using a ton of different parameters. And all of these components that we measured in the lip health survey were included as part of the efficacy grading. We also included instrumental measurements and subject self-assessment. So, our clinical efficacy grading data showed that lip balm treatment improved significantly the lip condition during the treatment period. And this is something which is expected, right? When you are treating your lips with a particular product, it is going to have improvement. So there was increase in lip hydration from baseline throughout the treatment period. There was a reduction in the water vapor loss, which is indicative of improved barrier function. Again, everything that is expected, but we have like really good quantitative data to support that. And the subject self assessment also indicated that the lip balm improved lip condition. But what is really most impressive is that even though the magnitude of improvement in parameters, it declined in the regression phase, the mean change from baseline still remained positive. And that means that the product, even when we are taken away treatment for 3 days, and on lips, that's a significant amount of time. When you don't use something for 3 to 4 days, the lips really didn't go back to baseline. They stayed much better. So our product improved lip health, quote unquote. That is what I'm trying to do here.
What do you think is happening there, Hemali? Like, because that is actually very, very interesting. Because what you're saying is this isn't just a temporizing measure. You're saying that there's a lasting effect even after the product has been discontinued. Why do you think that is? Or any hypotheses there?
Yeah, so if we collectively, I mean, it's hard to tell from the visual appearance, right? Like what is happening. But if we look at the biophysical measurements for hydration and water vapor loss, there was still not significant, but there was still an increased hydration level state of lips in comparison to baseline. And there was reduction in the water vapor loss. That means that the barrier health had in general improved. And so I think if the barrier health also improves, automatically the way the lips look is going to be improved as well.
Now, Molly, sorry, I wanted to jump in there because it really got me thinking about it. Maybe all of us, when we look at our lips, we think our lips are healthy as is. But maybe what your study is showing that is that maybe there's not at its optimal barrier
Correct.
function.
Mm-hmm.
And then so you kind of optimize that. And so maybe all of us are walking around with a slight bit of decreased barrier function. Maybe, I don't know. But at least in the participants that you selected, maybe their barrier.
So much throughout the day, right? Like the eating, talking,
Yeah.
licking, drinking.
Oh my gosh, the licking for sure. A lot of
Yeah.
lip smackers out there.
All the environmental exposure. So there is so much that is going on. So really, there is a need to protect them, especially when they are so thin. So, I mean, I'm not surprised at the fact that the product improved it during the treatment phase, but yes, the regression phase is most telling that
Yeah, exactly.
the lip barrier health was maintained.
That is so fascinating, Hemali, because it makes me really now start thinking about this. And you're kind of defining first kind of a baseline and then seeing what happens and how you fortify the barrier function by using this specific lip balm. Makes me think, okay, now I want to do more studies, right? We want to ask more questions. You mentioned food, toothpaste. So different diets, does that affect the health of our lips? It really opens a whole new area of investigation. Also the microbiome, because this is an area where the microbiome switches, right? The oral cavity has very specific microbiome compared to the cutaneous microbiome. So it just makes me start thinking, oh my gosh, we really got to look into this and see. This is kind of like a transition point between our skin and the oral mucosa. And you, by defining these basic properties now, are maybe opening the door for other research, which is really cool. And I love your thought, Raja, about this, which we may have suboptimal health, all of us, in our lips. And that leads me to the question about really maintaining that kind of success, How can patients really do this? I mean, obviously, there's a lot of products on the market, different types of products. Forget the brand names, just the different type of products. And there's a lot of regimens that include, a lot of moisturization, exfoliation, and that can sometimes even get to the lips. So how should we guide our patients and help them navigate so they can best manage and maintain healthy lips?
I always think that it is best to keep things simple.
Yes.
And, folks are using a lot of different face care products, but try to keep it away from your lips if possible. But in general, very simply put, just moisturize daily. And that is what we showed with our lip balm, right? It's a very basic lip balm. It has like 7 different ingredients. That's it. So you moisturize daily, moisturize multiple times a day, and protect your lips in daytime, because we know that the lower lip is prone to cancer. Burt's Bees has a wonderful SPF Lip Balm 30, which has a Skin Cancer Foundation seal of recommendation. And it addresses the top 3 signs of healthy lips that we discussed earlier, the lip lines and the even tone pigmentation. So that is what I would recommend, just simple, hydrate and protect. And even though I am very wary of TikTok trends, but because it is a rage right now, the skin slugging. So similar to skin slugging, lip slugging is a thing to do. And I have tried it and it kind of works. And we have this product, which is the overnight lip treatment with ceramides. It's perfect for that. On a day when I have walked around too much and I apply generous amount of that product and sleep in the morning, my lips feel really good and they look good too. So I think instead of skin slugging, we need to start thinking of lip slugging.
I think that's pretty interesting. That's funny too. I love that you're going around slugging your lips. With all the stuff that you're doing, one thing that is rest assured is that Burt's Bees is still innovating. So what is the focus of future research here? Where are you heading in terms of lip studies or just, what's on the horizon?
Mm-hmm. I would break this down into 3 things, I guess. Burt's Bees is synonymous with natural ingredients and sustainability. We have been doing that for 40 years. So needless to say, our innovations, our research is focused in this area. So one is using, green chemistry. There is a lot of fermentation processes right now which produce sustainable actives without depleting the natural sources. So that is one, along with sustainable packaging alternatives. Second is, and Hadar alluded to that, right? It's important to understand the role of microbiome. And we have slowly started doing that work a little bit. But how can it lead to personalized treatments? So there is quite a bit of work that needs to be done to translate this emerging science into skincare routines. So you're going to see a lot of, that stuff coming out from Burt's Bees R&D in the next, few months to a couple years. And then, broadly speaking, the purpose of all research and innovation is really to better lives, right? So our goal is to support skin health, including lip health at all stages of life. So, understanding and identifying these meaningful changes with, skin experts and dermatologists like yourself, we just started doing this by defining lip health. So that is where our focus is going to continue to stay in the future.
That's excellent. And I think we can all agree that when it comes to lip health and really trying to push the envelope and conducting more research, you guys are not just paying lip service. You are doing the right stuff. So really thanking you for joining us here on the program again. We love to have you, Hemali, and always bring fresh data, interesting data, things that I don't think anybody is really looking into. So thank you for the expertise and sharing this with us here. And I believe for the first time. So you heard it first on the LearnSkin podcast. Thank you, Hemali.
Folks, I hope you enjoyed this episode. And if you enjoy learning about integrative dermatology, we want to fill you in on a little secret. It does not have to stop here.
That's correct. You should become a premium member.
A premium member? Hey, Raja, tell us, what does that mean?
Well, we have a private community at LearnSkin for practitioners who want to learn more and connect even more closely with like-minded colleagues.
That's correct. This is something that we have developed over the years based on what we wished we learned in training. Not only do you get a discount to the annual Integrative Dermatology Symposium, but you also get exclusive access to content that is not available to the public and a private online community to network and engage with.
So don't wait. Together, we can advance patient care. Join us as a premium member today, and let's get integrated.